My name is Austin McGrew Haynes. My NSU identification number is N01912466. I would like to begin this video by thanking the Office of Admissions for taking the time to review my video essay. The question states, why do you want to become an occupational therapist? How did you first become aware or interested in OT? I'd like to be an occupational therapist because I would like to transform the lives of my patients. And helping my patients find a sense of independence is my main goal through this career. I became aware of occupational therapy my sophomore year of college when I became a rehabilitation aide at a skilled nursing facility. During my time at the nursing home, I was able to see the work of the OT and the strides that each of their patients were making, and I could only see myself doing that. Additionally, I've seen OT's work in settings such as Handwriting Without Tears and Best Buddies. I've seen the importance that the occupational therapist plays in the lives of these individuals and how they help them to grow and become more independent each and every day. The next question states, in your view, how is occupational therapy different from physical therapy? Occupational therapy is different from physical therapy in that occupational therapy works on more of the fine motor skills and physical therapy works on more of the gross motor skills. Additionally, occupational therapy works on things called ADLs, or activities of daily living. These are things such as self-feeding, bathing, toileting, doing laundry, or other household items, or things that you just encounter in your everyday life. Why do you want to get a doctoral degree when the current entry-level requirement is a master's degree? A doctoral program provides the most information available about the field. Additionally, it will allow me to teach others in the future. A doctoral degree also provides a research component that will further cultivate my skills as a clinician in the future. How do you see yourself 10 years from now? How do you see the NSU OTD program as helping you achieve these goals? 10 years from now, I see myself working as a board-certified pediatric occupational therapist working in an outpatient clinic. Additionally, I plan to be working specifically with children with severe developmental disabilities as well as autism. NSU will help me to achieve these goals by equipping me with the knowledge to treat in both a strategic and creative manner. What do you know about the NSU Tampa Entry-Level Doctorate Program? What are your reasons for wanting to attend this program versus other programs? The NSU Tampa Entry-Level Doctorate Program is accredited by the Accreditation Council for Occupational Therapy Education. Additionally, the program setup is a blended program. This means a portion of the classes are done distance learning, while the other portion is done face-to-face. The program is approximately 3 2/3 years long. Students also participate in the Level 1 fieldwork, Level 2 fieldwork, as well as a doctoral residency. My reason for picking the NSU Tampa Entry-Level Doctorate Program over other programs is this program allows a certain level of flexibility in both allowing me to work as well as giving me the option to commute to each class when necessary to meet on campus. Describe your experiences with online learning. What do you think it takes to be successful when attending online classes? My experience with online classes has been one of the best experiences in my collegiate career. The flexibility of the classes allows time for me to work and volunteer while pursuing a degree that I am passionate about. In order to be successful in online classes, you must be disciplined, determined, and able to prioritize. Additionally, I think it is important to have a support system, those who are cheering you on and wanting to see you succeed. What's the phrase, taking responsibility for your own learning mean to you? Taking responsibility for my own learning means that I have a goal to achieve and I must do everything in my power to achieve it. That means I must be disciplined in my studies and diligent in my coursework each and every day. This also means there will be times where I'll have to make great sacrifices, but in order to achieve my goal, I must take my learning into my own hands and study and do what I'm supposed to do in order to be the best future occupational therapist that I can be. Describe why cultural diversity and subsequently cultural competence is an important consideration in the field of occupational therapy. Cultural diversity in occupational therapy accounts for the different races, religions, ethnicity, and so on of the therapists in the field. Each therapist is shaped by their personal backgrounds and therefore has made them the therapist that they are. This provides a positive light in occupational therapy in that each therapist is granted the opportunity to learn from other therapists in the field. In terms of the patient, it's important to realize that each patient is a unique individual and they should be treated as so. Scenario 1. After taking a very hard exam, you find out that several of your classmates got a copy of the exam ahead of time and did very well. The rest of the class failed the exam, including you. The instructor informs the class that she will not curve the exam because of the students who did so well. What do you do? In this moment, I will take this as a learning opportunity. While I'll be disappointed in my grade, I will go back and seek clarification on the things that I missed on the test. This way, in the future, I am better prepared to answer questions and ensure that I am receiving the best understanding of the information being presented to me. Scenario 2. You're working in an outpatient clinic and a client of yours who has had hand surgery is not making good progress. Her surgeon has a poor reputation in the clinic. One day the client says to you, "I do not feel like I'm getting better. Was my surgeon any good?" What do you consider in attempting to resolve this ethical dilemma, and what do you say or do? When resolving this ethical dilemma, I think it's very important not to degrade the surgeon in front of the patient nor amongst clinicians. At this time, my job is to focus on the patient and their progress and helping them to get better as soon as possible. Since my program is not working, I think then I will enlist the help of other occupational therapists to help me refine my goals as well as the therapeutic measures I'm using to treat the patient. Identify your strengths and identify areas in which you need to grow. My strengths are that I'm both caring and compassionate. I'm caring in that I really would like to see all of my classmates succeed, and anything that I can do to help them do that, I'll be happy to do so. Additionally, I am passionate. I'm passionate about the field of occupational therapy. I am eager to learn as much as I can and to uphold the morals and standards of the occupational therapist. An area I need to grow in is that I'm overly self-critical. I want to be the very best that I can be, and sometimes I'm too hard on myself, and I have to realize that there's room to make mistakes. I just need to learn from them. Number of applicants waiting to be interviewed. Why should we take you? I believe that Nova Southeastern University entry-level doctoral program should take me because I am quite confident in my abilities to succeed in their entry-level doctoral program. I am eager and ready to learn as much as I possibly can about the field of occupational therapy, and I am ready to put my best foot forward in all that I do to succeed in this program. I also believe that the professors in this program will help me to become a creative and strategic therapist and ultimately make me the best clinician that I possibly can be. I'd like to thank the Office of Admissions for taking the time to review my video essay. I look forward to hearing from you guys and hope that you have the best day. Thank you so much.